Your first item for discussion is item number 8, entitled Addressing the Impacts of the Migrant Shelter Crisis in San Diego County. There are 29 individual requests to speak on this item, 27 in favor, 2 in opposition. There's also 1 request for a group presentation in favor, and 3 individuals who are registering their opinion in favor but do not wish to address the board. This item was brought forward by Supervisor Fletcher and Vice Chairman Cox.
Vice Chair Cox, would you like to start off with some comments?
Thank you, Madam Chair. Over the holidays, Supervisor Fletcher and I had the opportunity to visit the migrant shelter operated by the San Diego Rapid Response Network. During that visit, I think I learned, and I think all of us learned. In fact, I want to acknowledge that our Chief Administrative Officer, Helen Robbins-Meyer, and Don Stoyer, our Assistant CAO, had an opportunity to be on that tour. Excuse me. We learned a lot about the selfless work that is going on by community partners and volunteers to provide temporary support to asylum-seeking families as they await their due process in our community. This population is made up of families, and it's all families, that have been granted permission to be in this country temporarily by the federal government until they unite with their sponsor, primarily in other states, and attend their court hearings. I want to take a moment to thank these community partners like Jewish Family Services, Catholic Charities, San Ysidro Health, La Maestra, the ACLU, and the many other volunteers. And it was amazing to see the variety of individuals that just out of a sense of compassion have volunteered to come down there, particularly over the holidays, to provide service, and other service organizations that really make up the San Diego Rapid Response Network. And they've just done a tremendous job, in my opinion, in trying to address this situation. Today's action builds on the momentum that frankly was started by our previous chair, Supervisor Kristen Gaspar, when she sent a letter urging the state of California and the federal government to fully address this crisis in our community by providing temporary shelter for asylum-seeking families. At the same time, we will also look at our own surplus properties that may be appropriate for the state or other entities to temporarily house these children and families during their short stay. Our primary concern as stewards of the public good is preventing any public health issues from arising during this migrant crisis. Ultimately, we need federal solutions to fully address immigration in this country. In the meantime, we will do our part locally to foster regional coordination and cooperation that can lead to both short-term and long-term solutions for this humanitarian crisis. And I know that my colleague, Supervisor Fletcher, I think, may have some additional comments.
Thank you, Supervisor. Supervisor Fletcher, would you like to make some opening comments?
Yes, thank you, Madam Chair. I want to thank Supervisor Cox for his work on this effort, and I want to thank Supervisor Gaspar for her efforts to get the state engaged. I think it's important when we talk about this issue, we recognize, despite the debates that may take place about immigration or refugees, these are folks who all follow the law. We often say when it comes to immigration that if folks follow the law, that's something that we should applaud, and they followed it. The Trump administration has determined these folks have a legal standing to be here in our country. Now, after determining that standing, they then fell down on their end of the deal to help ensure these folks have transportation out of the region to their sponsors, to ensure their public health, to ensure their safety and welfare. And I think I can say with confidence there's probably no one on this board that is more in tune with banging on the failures of the federal government than me. But having said that, our obligation and responsibility remains with public health. And there's no exception from our obligation to public health because the federal government makes it hard. There's no exception from public health because the city makes it hard or the state makes it hard. That burden falls on us. Whether it's convenient, whether we want to do it, we have that obligation. And I think what we have put forward today is a very modest effort to do a handful of things. One, to direct the Chief Administrative Officers, continue the efforts that Supervisor Gasper started on getting the state more engaged and potentially finding a state location. Second thing is to create this working group where the city will participate, and the city's committed to do that. The county will participate. The state has committed to do that. I've talked to members of the legislature and our new governor who have committed to be a part of that process with us, along with the advocates who have done a heroic task to date, so we can really assess and figure out roles and responsibilities and things that need to happen on an ongoing basis from a long-term standpoint, and then to look at the possibility of vacant or abandoned or unused county properties that might be considered or might be available on a temporary basis to house these folks as the nonprofits in the state pay for the operations of that center, so that we really can ensure not only the basic humanitarian obligation that we all feel as individuals, but that public health duty and obligation which is upon us. I think in the absence of the failure of us collectively to do this, we run the risk of these individuals being released from immigration custody and literally wandering the streets of San Diego. And in that situation, were that to happen, we have a potential public health risk. We have an increased burden on our county staff that still has to find and assess and figure out what is the situation with these individuals. And we run the risk of compounding our already very severe homeless crisis. These individuals are not without shelter. They're just without shelter here. They have families who are willing to take them, and merely what we're talking about doing is partnering with our nonprofits and partnering with the state to make sure that in a humane way these folks can be brought in, and nonprofits can fund their travel to their families who will shelter and house and feed them and care for them until their final adjudication of their claim. And so I think in the interest of both, you know, what we believe as individuals for how we treat women and children and folks who have followed the legal process, but also consistent with our obligation to shoulder our share of the load, particularly when it comes to public health, I would hope that we could build some consensus and some support behind this bipartisan effort to try and engage in this and do what we can to try and make a positive difference.
Thank you. We do have quite a number of speakers. I'm going to go to the clerk to read the names of the people. We have organized presentation, and we do have individual speakers on both sides of this issue.
Begin with the request for a group presentation. I'd like to invite forward David Trujillo, Martin Lawson, Jill Spitzer, Reverend Janine Shanone, and Michael Hopkins. You'll have 10 minutes to address the board. All of those within the group presentation must address the board during the 10 minutes. Please self-regulate your time using the timer on the podium. And as you begin your comments, please state your name for the audio record.
Good morning, Chairwoman Jacobs and Supervisors. My name is David Trujillo. I'm the Advocacy Director for ACLU San Diego and Imperial Counties. The ACLU is a core member of the San Diego Rapid Response Network, a coalition of human rights and human liberties organizations, community and faith-based organizations formed just over a year ago to monitor immigration enforcement and overreach and abuses occurring in our region. We did not expect to be providing emergency shelter. That is not a traditional ACLU programmatic work. But nevertheless, we believe that every asylum seeker has a right to just and humane treatment. We are hopeful we will see immediate progress on government funding for migrant shelter operations and case management services, including travel, medical, and legal help. Secondly, we would like to see a confirmed, suitable, and long-term location for the shelter. And finally, as the establishment of a regional working group made up of federal, state, county, and local regional stakeholders to address both short-term and long-term solutions for the migrant shelter crisis here in San Diego. I want to emphasize that what San Diego County is experiencing is a migrant shelter crisis caused by anti-immigrant policies and rhetoric that undermine just and humane asylum process. These folks are here legally, seeking a legal process for asylum, and San Diego has a rich history of being a welcoming place for refugees, for people looking for asylum. Since October 26th, U.S. Immigration and Customs Enforcement, ICE, has released hundreds of migrant families without warning and without following their usual protocol that ensures asylum seekers have travel plans and a means to join sponsors elsewhere in the U.S. ICE is abandoning these asylum-seeking families on the streets of San Diego without food, transportation, or shelter. And until recently, ICE did not coordinate or even communicate with local government or nonprofit agencies that were willing to help. The Rapid Response Network is helping to address this migrant shelter crisis created by the federal government. Our shelter has hosted more than 4,500 families since we opened in November 2018. All of them have been families, parents with small children, nearly all of them going somewhere else in this country. By latest count, over 8,500 unsheltered people live in San Diego County, the nation's fourth largest homeless population in the country. ICE is adding 70 to 100 people to that population each and every day. And in the absence of a shared governmental response to that crisis, our nonprofit network has been the only resource for people who would otherwise be alone and destitute in our communities when they didn't have to. This is a leadership moment. San Diego County must provide proactive solutions to address this migrant shelter. We urge you to protect the safety and well-being of those most vulnerable county residents, and for the very brief time they are in our region. We urge you to approve Supervisor Cox and Supervisor Fletcher's recommendations. Thank you for your careful consideration to this very urgent issue.
Thank you.
Hi, Supervisor Jacobs and members of the board. I'm Rabbi Marty Lawson. I've been a clergy member in this community for 43 years now. And yesterday I had the opportunity to, as you did, to visit the shelter. I looked into the eyes of those children, mothers and fathers. I witnessed a young man kneeling before a crucifix, his head down, and I saw in his eyes afterwards, as he smiled at me when he finished his prayers, I saw in him the need for compassion and leadership of this community on a moral basis. In the Hebrew Bible, we read the words, "Remember the heart of the stranger, ki gerim heyitem be'eretz Mitzrayim." Remember the heart of the stranger because you were strangers in the land of Egypt. We have the moral responsibility, and we need to take the leadership in this community to do everything that we can to bring these people, as people did for our ancestors, for our grandparents in earlier generations, into this country, to make them feel welcome. A number of years ago, when we, in our congregation, were welcoming boat people from Southeast Asia, there was worry in the community, again, at that time, as to what would become of these families. Would they become a burden, a responsibility on the community at large? I want to tell you that one particular family, we now have 2 doctors and 2 attorneys serving the state of California and the people of California. And I just think that we have to remember what we have done in the past and learn from that and then take action for the future. I hope you will step up to the plate for that responsibility. Thank you.
Thank you.
Good morning, Supervisors. I'm Michael Hopkins, CEO of Jewish Family Service. I'm speaking as the NGO operator of the shelter, and I also have a perspective as a board member of the Regional Task Force on the Homelessness. First, I'd like to express my thanks to Supervisors Cox and Fletcher for their commitment to this issue and by visiting our shelter over the holidays and introducing this agenda item. I also need to thank all of you for the public health nurses that have been at the shelter and providing critical medical screening. Jewish Family Service stands strongly in support of your request. As an organization, we've been welcoming newcomers from around the world for the past 100 years. JFS is interested in addressing today's humanitarian crisis by meeting the pressing needs of migrant families seeking asylum at our border and being released into our community. It is our civic and moral obligation to care for their health and safety and security in the shelter in what is a very short period of time. Most families spend between 24 to 48 hours in the shelter, and then they're reunited with family members across the country. In the past 9 weeks, we have provided emergency shelter and coordination, as you heard, for over 4,500 individuals, mostly women and mostly with really, really young children. We provide a place to sleep, food, clothing, health services, legal assistance, and then at the very end, airplane and bus tickets to get families back to meet with their loved ones around the country. The operation has evolved, and so there's a lot of information about what it was and what it is today. It started as a grassroots, volunteer-driven project, and today it's a well-organized, staff-run transitional shelter that meets the needs of families 24 hours a day. To effectively address this humanitarian crisis in San Diego, we are calling on elected leaders at all levels to act immediately to develop and implement a sustainable plan to keep vulnerable asylum-seeking families off of our streets and help them reach their destinations. The sustainable plan has three components. First, it must provide resources for required staffing. JFS has operated the shelter for the past 2 months and recognizes that a successful operation requires adequate resources of a diverse professional staff with expertise in shelter management, logistics, travel, legal, case management, and health care. Second is the identification of a suitable larger shelter facility. We currently on certain nights operate even 2 shelters in response to the constant ebb and flow of the number of folks that are dropped off by ICE. High quality and cost-effective delivery service requires a single facility that can accommodate at least 150 individuals. The facility we're in today that we need to be out of by February 7th holds 97 individuals. And third and finally, we must establish a regional work group. It appears that the state and county and the city and everyone is interested in helping out, but there doesn't seem to be the place where all parties come together and work on this problem collectively. We urge you to approve Supervisors Cox and Fletcher's recommendation. Absent of a viable long-term solution, the county government and all of us will fail in our responsibility to ensure that the community is safe, healthy, and secure. Thank you.
Thank you.
Good morning. I am the Reverend Janine Scanoni from Good Samaritan Episcopal Church in San Diego. I've been helping at the bus stations, at the shelter, and I've also been working at my church as a central collection station for donations of money and food and clothing that are coming from around the country. And now we're asking for our county to step up and help us. We're very grateful for the assistance you've provided so far with medical treatment on site at the shelters, but we need a permanent shelter. I wanted to give a human face to some of the asylum seekers I have met and why they have come to our country. They've been admitted legally because where they were, their children were being kidnapped from the streets in Honduras and Guatemala and Colombia. Their family members were being shot, and they had guns put to their own heads, and they were told to leave. And so they have come here to this country where they have family and friends who can take care of them. We have been doing an amazing job. We Houses of Faith and we nonprofits like Jewish Family Service. It has been a tremendous group effort. And now we ask you to join with us and partner in that effort and just give us a place to keep these people safe for a day or two. Thank you, and God bless.
Thank you. I'm going to grant the entire 15 minutes since you have so many in your group, so the rest of you can have a chance to.
Thank you. Thank you very much. Good morning. My name is Jill Spitzer. I am a volunteer at the Rapid Response Network Shelter and a former CEO of Jewish Family Service. Since late October, the federal government has been releasing asylum-seeking migrant families onto San Diego streets without food, transportation, or shelter. As a volunteer, it has been incredible to see the Rapid Response Network's tremendous work to ensure more than 4,200 children and parents fleeing violence and persecution receive temporary shelter and travel assistance. As you can imagine, an operation that provides shelter services, case management, legal assistance, and travel coordination requires significant resources to support personnel and direct expenses. This also includes staff and infrastructure to oversee a robust group of volunteers to ensure effective utilization of community members like me who wish to give their time. The Rapid Response Network's efforts were intended as a stopgap measure, but the scope and duration of this emergency has surpassed the network's collective ability to continue providing basic resources, food, shelter, emergency health care, and travel assistance, that asylum-seeking families desperately need. General operating funding from state and local governments is essential to support at least 6 months of operations to respond to surges in migrant arrivals to our region. Sustainable government funding and individual donations are needed to maintain the extensive daily operation of the shelter and to support cross-country travel coordination expenses to ensure thousands of migrant families can quickly and safely leave San Diego to reunite with relatives across the United States. That's the goal. For the past 9 weeks, the Rapid Response Network has utilized a diminishing pool of funding from government and private philanthropy. We need your help now. In addition to your financial support, donations to support shelter operations and travel coordination can be made at GoFundMe.com/MigrantReliefSD, which has raised more than $140,000 to date. We also are seeking direct financial assistance for bus and plane fare at sharejourneysd.org/families. Thank you very much for your time.
Thank you. We'll proceed with individual speakers.
I'd like to invite forward the first group of individual speakers in favor: David Garcias, Caroline Thace-Ard, Claudia Gonzalez, Loxie Grant, and Robert Link. You'll have 2 minutes to address the board. Please begin your comments by stating your name for the audio record. You're welcome to come forward in any order if I have called your name.
Thank you. I'm David Garcias. I'm the president of SEIU Local 221. Thank you, Madam Chair, members of the board, Madam CAO. So first, SEIU Local 221 is a founding partner of the San Diego Rapid Response Network. Our members not only provide from the public health side as nurses, as eligibility workers, but we also have folks volunteering. Our members are out there volunteering for this organization, and we are trying to help these families. This is a problem that's been brought on by our national administration. When they dropped off entire families downtown in Petco Park area, and this is families with children, the potential of exploitation is there. And these folks come in with, some of them don't even speak the language, either Spanish or English, because some of them have other languages more native to their countries. And they're here because they are seeking protection for their families. They're here lawfully exercising their right to seek protection. And we need bold leadership from this board. And I appreciate the efforts of Supervisor Cox and Supervisor Fletcher, and also CAO Helen Robin Myers for coming out and seeing the shelter. But we need help. These folks, these families who are dropped off in the middle of downtown and don't know where to go, and they want to just find a way to get to their location where their families are. This is an important moment where we need to step up as the public health agency and be able to take care of these folks, but not increase the homeless population. So please support the measure from Supervisor Cox and Supervisor Fletcher. Thank you.
Thank you, David. I'm going to advise future speakers, and this is going to get harder and harder to do, but if someone else has already said what you're going to say, if you could just say you agree, and then we can move on and expedite our process. I want everybody to make sure they get all their points out, but not to repeat. Thank you.
Hello, my name is Loxie Gant, and I am a volunteer with the Minority Humanitarian Foundation. Although Rapid Response Network has done a great job in responding to the crisis, there have been many other organizations not directly affiliated that have been helping out. I wanted to talk to you about the public health crisis and one of the issues that personally affected me and my family. Through Rapid Response contacted Mark Lane at Minority Humanitarian Foundation and said, we need your help with this one specific family. What they didn't tell us was that they had diagnosed a child in that family with chickenpox. They had released that family to Mark Lane and to our organization, and I agreed to take them into my home, unknowing that they had already been diagnosed inside of the response network. The problem with that, and we know that there's a lot in this, we're just hoping the benefit of the doubt that this fell through the cracks and this wasn't an intentional thing, but it directly affected me, my family, my daughter's preschool. We all had to go get inoculations. Everybody had to get their vaccines for shingles vaccine, even my daughter's grandparents. So it really kind of the ripple effects of that really do exist. And so we know that ICE released them, first of all, with knowing that the child potentially had an illness and handed them to Rapid Response. So it's sort of a triage of a problem that leads to more and more people potentially becoming affected by this health risk. So I just ask you, aside from finding a shelter and a permanent place for them to go, or temporary permanent place for them to go, really to get county health involved, everyone coming out of these detention facilities needs to be screened, treated, and we need to somehow do more to prevent the spread of the diseases or anything else, any other viruses that are coming across. Thank you.
Thank you. Next speaker, please.
Good morning, ladies and gentlemen. My name is Claudia Gonzalez. I'm a registered nurse in the community, and I was actually a volunteer also at the shelter. Protecting the health and welfare of all in this region is your job as elected officials. When I heard asylum-seeking families were being left out in the streets, I did not hesitate to volunteer all of my time during the months of November and December of last year. I felt it was the least I could do, although for me it was a choice. For all of you, this is not a choice, but a responsibility and your moral obligation to protect immigrant families and prevent a public health crisis in the streets of San Diego. Most of the patients that I personally triaged while working at the shelter had some form of communicable diseases, such as colds, flu infections, infestations. Communicable diseases are caused by microorganisms such as bacteria, viruses, parasites, and fungi, and can be spread directly or indirectly from one person to another. As a nurse, I understand that a simple cold will not kill anyone, but there are other conditions like chickenpox that, if left untreated, can cause serious life-threatening conditions and possible outbreaks. My concern as a nurse and as a citizen of San Diego is that these infectious diseases, if left untreated, can lead to greater problems for the general public. The solution, aggressive action must be taken to protect the health of both immigrant families and public health in general. The county must do their part to make sure this doesn't become a public health problem. Rather than wait for a public health crisis, we should address this issue proactively, and if there is something I have learned as a nurse, is that prevention is much cheaper than treatment. It is imperative that the county provide a viable long-term solution so that all the medical needs of these migrant families are addressed and any possible outbreaks can be stopped before these families reach their final destinations. If the county government fails in its critical responsibility to protect the health of these migrant families, you will have to answer to 3.3 million San Diegans for doing nothing to prevent a public health crisis, and not to mention the monetary cost of controlling and containing an outbreak. Thank you for your time and consideration.
Thank you. Next speaker, please.
Good morning. My name is Caroline Thieser, and I'm with the North County Immigration Task Force and also Pilgrim Church in Carlsbad Immigration Ministry Team. We're an all-volunteer organization that works with the immigrant community in North County, and we're also a partner organization with San Diego Rapid Response Network. As others have said, seeking asylum is legal. These families have followed the process and been determined to have credible fear. This is a nonpartisan issue that defines who we are as a city and as a county. No child should have to sleep on the street or go to bed hungry on our watch. The San Diego Rapid Response Network has stepped up along with hundreds of volunteers But the leadership of the county is urgently needed now to coordinate services with the state and the city and the county, and to identify a facility that can be used without having to move on a regular basis, by providing funds to the nonprofits that are doing this work, that have kind of rescued this situation. As I said previously, I hope we can all agree that no family should have to sleep on the street. These are our streets. And by using some of our surplus funds while working with city, county, and state agencies, you have the power to ensure their safety and their humane treatment of all of these people who've suffered so much already. So I hope you guys will step up. Thank you.
Thank you. Next, please.
As the next speaker is approaching the podium, I'd like to invite forward the next group of individual speakers in favor: Michael McConnell, Mark Adams, Brett Weiss, Catherine LaPointe, and Ali Turabi. Sir?
Hey, good morning. Thank you very much, Supervisor Cox and Fletcher, for advocating for solutions, moral and compassionate solutions for our migrant population that are seeking desperately needed help in this area. I'm here actually as a proponent for a Camp Barrett solution with the City of San Diego through the nonprofit.
Sir, I'm sorry to interrupt. Could you please state your name for the audio record?
Oh, I'm sorry. My name is Bob Link, downtown resident. Thank you. For the Camp Barrett facility, the City of San Diego has challenged a consortium of people, including Uplift San Diego, which is focused on shelter, education, and family reunification for the homeless population. And we responded to that directly from the homeless direction and help, which also need help and have, in fact, an opportunity for competing resources to be relieved through like-minded solutions. The Camp Barrett opportunity provides the opportunity to provide a permanent solution. It's got an opportunity for 120 residents there now, and that can be expanded. We're a proponent for a modular approach, so that can be expanded rapidly in that area. And the Camp Barrett is, of course, we know, an East County facility in Alpine that is readily available. It's a closed juvenile detention center that is available to occupy virtually immediately with minor property upgrades. In addition to that, on the homeless perspective, we're looking for Camp Barrett to be an opportunity to provide jobs, education, outreach, and to provide permanent solutions for that population. Realizing that the migrant population is moving through, we have an opportunity to coordinate funds and assets to create this facility and move forward on a real solution that provides real known and respected services to the individuals as they are with us, and then provide life skills, education, and training moving forward. Thank you very much.
Thank you. Next speaker, please.
Good morning. My name is Mark Adams, and I am a campus minister at the University of San Diego. I'm here today to ask that we all seize the opportunity to show compassion to our migrant brothers and sisters and all those who have been walking with them and supporting them. I've been volunteering on an individual basis at the San Diego Rapid Response Network shelter, and I've been able to see the beautiful collaboration between so many organizations and people of faith. I've also seen how they have been stretched to the limit, how so many people have been working 10, 12, 14-hour days in an effort to try to be there for each and every family. It has been very, very difficult. I've gotten to know various folks who have gone through our immigration system. So many come out of it, come out of detention hungry and cold and lost, and with a sense that they have been completely abandoned. Thank God, and I do thank God, that there are resources out there for them through these nonprofit network. But I ask that we add additional resources from the county to assist in those efforts. I'm here not because I thought about speaking today, but I felt compelled to speak. I feel that my faith calls me to speak up and welcome the stranger. And so I ask each of you today to take a stand, to join in the leadership in requesting more support, more resources be given to our migrant brothers and sisters and all of those who are working to accompany them. Thank you.
Thank you. Next, please.
Excuse me. Hi, thank you for listening to us this morning. My name is Catherine LaPointe, and I am a full-time volunteer at the Safe Harbors Immigrant Shelter in City Heights, a ministry of Pastor Bill Jenkins and the Christ Methodist Church, who housed thousands of Haitians last year. I would like to point out the efforts of all of us to address this crisis. Our facility housed a few hundred guests in the week before midterms. You didn't know about it. It wasn't in the news because our small shelter and all of the local agencies worked around the clock to prevent the optics of immigrants flooding into our streets. I would like to also let you know that there are more displaced people on the face of the earth than at any time in human history. With our homeless problems here in San Diego, with our need to take care of our veterans, why should we care? We can't address the world's suffering. We should care because of a beloved piece of international law developed after World War II, when 6 million people were killed because they belonged to a protected group. The Refugee Convention of 1951, and the 1967 Protocol, to which the United States is a signatory, demands that we keep people alive if they are threatened because they belong to a protected group. This is a Sisyphean effort, a Herculean effort, a faith effort. I invite you not to see this problem as a scarcity model, but an opportunity to reflect and represent America's finest city as a model.
Thank you. Thank you, ma'am. Next speaker, please.
Good morning, County Board of Supervisors, and welcome Supervisors Desmond and Fletcher. My name is Brett Weiss, and I'm here on behalf of San Diego City Councilmember Chris Ward to discuss and to support this item. We want to say that current reckless federal policies have created an ongoing crisis in San Diego for migrants who are legally seeking asylum at our border. While local nonprofits, government entities, and volunteers have been doing exceptional work with stopgap measures, a more formal, permanent response to provide humanitarian assistance to asylum-seeking families is critical. And I also want to point out a statistic that David from the ACLU brought up earlier with 4,500 individuals who were provided support by a nonprofit. And that just shows that institutional support is necessary for this. And this is best coordinated through the county, and the city is prepared to work as a supporting partner to ensure that these families are treated with dignity and provided the support that they deserve. Our office supports the recommendations of Supervisors Cox and Fletcher, and we look forward to taking this step towards addressing this humanitarian crisis. Thank you.
Thank you. Next, please.
Good morning, Supervisors, Chair. My name is Michael McConnell. I'm a founding member of Funders Together to End Homelessness, the San Diego affiliate, the past vice chair of the Regional Task Force on the Homeless, a former leadership team member of the 25 cities effort to reduce veteran and chronic homelessness, and various other positions over the last 9 years in my volunteer work on homelessness, but primarily I'm a homeless advocate. I've also done a lot of work on data in our homeless service system, so I'd like to just come here and support the item that's being presented and to talk a little bit about our homeless service system and the potential impacts. Many broken systems feed our homeless service system, whether it's criminal justice or foster care, mental health services, drug treatment services, many things. Many of these broken systems feed homelessness, and this is just one more broken system that has the potential to feed our homeless service system. These homeless services are oftentimes very specific to a population. For example, our veteran homeless service system, which is very well funded, has beds available for homeless veterans, both temporary housing beds and hundreds of unused housing vouchers in the city and county for homeless veterans that are being unused today. So this will not take funding away from some of these specific populations that we care so much about and have worked on, and many of you have worked on and have talked about putting a specific focus on. The cheapest and most effective way to work on homelessness is to divert people from entering our homeless service system, which I believe this proposal does very well. It appears to be very efficient. It keeps people out of homelessness by only being in the shelter for a few days. They have resources at the other end. So they will not be drawing from our permanent resources. This is a very short-term intervention to divert people out of homelessness in the first place.
Thank you, sir.
Thank you so much.
Next speaker, please.
As the next speaker is approaching, I'd like to invite forward the next group of speakers in favor: Alicia Riley, Margaret Baker, Deborah Terry, Raymond Duval, and Ava Perez. Sir?
Thank you, Board, for holding this meeting. First off, I want to say thank you to the ACLU, JFS, the Catholic Charities, Rapid Response Network, and every other organization that is helping with this humanitarian crisis. I want to begin by saying that there's one thing we can do to help, and that's getting our healthcare providers in the detention centers to triage before anyone's released.
I'm going to pause your time to give you the opportunity to state your name for the record.
My name is Ali Tarabi. I'm one of the board directors for the San Diego Board of Dreamers. I want to bring to light to the fact that we as a community have been pointing out the humanitarian crisis that has been taking place in these border communities for a decade now. When they were separating our families, we came out here pleading for help, and nothing was done. When they started implementing anti-immigrant policies at the border to separate children from their parents and place them in cages, we pleaded, and nothing was done. Then they started gassing asylum seekers, those that are coming to this country to seek refuge, and nothing was done. And only when 2 of our children lost their lives in these detention centers, the same detention centers that they placed my mother in, then you started focusing on this humanitarian crisis. And I bring this up because I see myself in those children, because I am undocumented. And I was denied asylum in this country. And this country decided that I was not good enough, that I had nothing to provide, in the same way they're doing to the children that are here today. And they put an OR at the end of my name, an order of removal. And they determined that I was deportable, that I brought no value here. And I come to you today because I changed that, and I never gave up in the faith that my mom had in me, and I will be pushing forward and going to medical school and changing that OR to an MD, a medical doctor. And I see, because of the opportunities this country gave me, that I'm able to do that. And I feel that these children, who are no different than me and my brother and my sisters and brothers, all my dreamer sisters and brothers, that they deserve the opportunity to live in this country and to achieve their dreams as well. So I hope that you all support Supervisor Cox and Fletcher's order here. Thank you.
Thank you. Next, please.
Good morning. My name is Margaret Baker, and I'm a volunteer with the San Diego Rapid Response Network. I live in Chula Vista, and I've been working to ensure that no more families are left on the streets of San Diego County. I'm one of the first rapid responders to arrive. I'm one of the ones that goes out to hunt for the families when they're being dumped in strange places, sometimes at the outlet, sometimes right down by the McDonald's, sometimes on a block or two away from our downtown Greyhound bus depot. You never know the time, how many people, or the conditions that you'll find them in. I see them cold, confused, hungry, thirsty, often sick, and completely vulnerable to anyone who might extort them. And we've experienced this also, trying to save people who've gotten into taxi cabs and gone off with people who have then tried to get money from them. So as I ask them where they're from and where they're going, the families sometimes share some of the horrors of their journeys and reasons that drove them to take the extraordinary step of seeking asylum in the United States with part of their family, often leaving behind loved ones in hope that they will find safety for at least those with whom they are traveling. Unfortunately, the trauma does not end when they cross the border and present themselves to immigration authorities. What is disturbing me the most, more than anything, are their accounts of the mistreatment while they're in custody of the U.S. government, including lack of adequate food and fluids, the cold, noisy, overcrowded conditions that make sleep nearly impossible, the lack of attention to medical issues, the verbal abuse, including demeaning, name-calling, threatening, bullying behavior, and this is daily. Men cry and fall into my arms from what they've been said, what's been said to them, and the shaming of women when they attempt to breastfeed their babies. Some of the women's milk has gone dry because of the conditions that they've been exposed to. So the time these parents and children spend in detention is breaking them down physically, mentally, and emotionally. And these are the people we're finding on the streets. Often after 8 p.m. with electronic shackles that track them.
Thank you.
And they don't even know where they are. We need to help these people.
Thank you. Next, please.
My name is Alicia Riley. I'm a resident of Chula Vista, a sociologist, and a volunteer with the shelter. I just wanted to make 3 brief points. We should think of this as a population of children. The busloads that drop off people from the detention center at our shelter are all children with parent guardians. No adult is dropped off without a child unless they're a pregnant mother. So this is a population of children, and it's a population of children and their guardians who are especially vulnerable to health emergencies. As the last speaker was just sharing, they're broken down physically and they're in a fragile state. And so what that means, and I can share that there was a morning at the end of October that I went out to San Isidro to try to look for a group of families. This is before we had a more coordinated effort. And I found a group of 18 people on the street. It was 7 adults and 11 children. And they had begged for money the night before, and they had managed to get $55 by begging for money on the street. And with that $55, they were able to pay for a $60 hotel room in San Isidro where they all stayed, all 18 of them. And they didn't eat. So 11 children didn't eat. And so what that means, I mean, we saw just in December, we had 2 deaths. These children's bodies can't put up with detention. It's an unprecedented situation. It's no one's fault in particular, but the Border Patrol detention facilities they can't ensure the health of these kids, and so they're released in this fragile state. And if we don't do something about it and continue to do something about it, there will be more deaths. There will be deaths, there'll be more health emergencies. The hotels will have to call the emergency room, the McDonald's, the Greyhound bus station. So this, we can't wish it away. And thank you for your time.
Thank you. Next, please.
Hello, my name is Sister Raymonda Duval. As you can see, I answer to about anything that is close to that. And I'm here today to ask you to support the proposal of Supervisor Cox and Fletcher. And as you've heard from people before me, this is really a problem that takes a village solution. And it takes each of us stepping forward and bringing to that problem the solutions that we have, what we have what we have and are able to share. San Diego is not the only border town. El Paso is another border town. And exactly the same thing is happening in El Paso. Migrants are left on the other side of the border. They go through the process of becoming legal asylees. An ankle bracelet is put on them, and they're left on the streets. El Paso has put part of their village together to be able to respond. Migrants find shelter, health care, interventions from the city, from the county, and from the state, just like San Diego. But unlike San Diego, El Paso doesn't have the 4th largest homeless population in the country. Other speakers have mentioned what the impact of migrants would be to the homeless population, to the services, to them themselves. So I urge you to do what Supervisor Fletcher has requested and Cox, that is put together a regional team, come up with a plan that will address in our village style how we will welcome migrants that are legal, help them assure their health, and then move them on to their families. Consider that, and please vote for that. Thank you very much.
Thank you. Next, please.
As the next speaker is approaching, I'd like to invite forward the next group of individual speakers in favor. Roni Breet, Marie Raftery, Elizabeth Pricer, Joe Ransdale, and Patricia Murphy. Ma'am?
Good morning. My name is Eva Perez, and I'm a resident of San Ysidro. Thank you, first, for acknowledging the work of the nonprofits as they have been exerting their resources to individuals, to protect valuable lives. These nonprofits are taking on the responsibility of addressing a humanitarian crisis that is created and prolonged by the lack of government aid. Each of you, as a government worker, are public servants. Each of you have the duty to protect the health and safety of those migrants who are seeking your help. Today, we have heard from multiple nonprofits who so selflessly give their resources to protect their neighbors. I welcome you and urge you to spend 5 hours of your time as a volunteer in these shelters. If you see that you cannot give your time, then I ask that you at least give the least amount of energy to support the adopting of the Cox and Fletcher recommendations.
Thank you. Next, please.
Good morning, Supervisor Chair Jacobs and fellow supervisors. I am Marie Raftery, Chair of Jewish Family Service. I ask that you consider the establishment and funding for the migrant shelter where JFS and our colleagues at the Rapid Response Team, plus countless volunteers mentioned by Supervisor Cox and Fletcher, have labored so diligently. We ask your consideration in assisting these immigrants here legally, seeking asylum. I have been to the shelter more than once, and as they have moved. We have assisted these families to move on to their families located throughout the country. Please consider how the Rapid Response and our colleagues are aiding these families follow through on their voyage, thus preventing further homelessness in San Diego. This issue is not a political issue. It is a humanitarian one. Our team, our organizations, pledge to legally and lawfully welcome the stranger, as suggested by Emma Lazarus, on our Statue of Liberty. Thank you.
Thank you. Next, please.
Hello, my name is Ronnie Bright, and first of all, I want to thank Supervisor Nathan Fletcher and Greg Cox for introducing this proposal, and all the rest of you for listening to this. I'm a volunteer at the shelter. I've been volunteering for about 2 months, 2 to 3 times a week, and because I speak Spanish, I interview a lot of the clients coming in, and I know their stories. And what I want to say most importantly is, if you could see what I see as a volunteer, if you could hear what I see here, and if you could feel what I feel there, you would absolutely approve a shelter for these people who are leaving in a couple of days. Their friends and their family are sponsoring them. For the most part, they are paying for their travel. We don't have to pay for that, except in rare occasions. What I see is, on Sunday when I was there, a family coming in, a father and his daughter, who's 5 years old, her hair unkempt, ravenous for the little snack they give them before a meal as they're registering, because that can take 20 minutes or so, stuffing the banana in her mouth, stuffing the bread in her mouth because they haven't been eating much. In detention, they get the same bean burrito for every meal. They get juice and they get peanut butter crackers, and the kids often won't eat the burritos. I see the children for the first time, and I don't know how long, sometimes their travel is 2 months, running around and playing together, feeling free. I tell the families they're welcome. Welcome to California, welcome to our shelter, you're safe here. I see the relief, just the stress draining out of them immediately. When I let them call their family or friends elsewhere in the country, I see the smiles on their faces when the person says, yes, I will buy you a Greyhound ticket. Yes, I will buy you an airplane ticket. I see the mom on Sunday. There was a mom with a tiny baby that looked newborn, and I went to talk to her. How old is your baby? ¿Cuántos años tiene? ¿Cuántos meses tiene? And she told me 5 days. 5 days ago, she gave birth and is still here. These are the people we need to help out.
Thank you.
Thank you.
Next, please.
As the next speaker is approaching, I'd like to invite forward the next group of individual speakers in favor: Sally Hunt, Cipriano Vargas, Tara Lawson-Raymond, Paul Among, and Bertie Gutierrez. Sir?
I'm Joe Ramsdell. I'm interim chair of the Alliance Healthcare Foundation.
I'm also a physician, an emeritus professor of medicine and former head of general internal medicine at UC San Diego. And I want to give my authority for what it's worth to many of the points that have been made today. I don't need to repeat them. The humanitarian aspects of this have been poignantly made. But I want to really focus a little bit more on the public health aspects of this. We've heard that these people are here only for 48 hours, but we've also had a personal story about an infectious disease exposure that occurred during that time. While these people are put back on the street, all we have to do is hearken back to the hepatitis A problem that we had to think of the potential public health issues that could arise from an undiagnosed case of tuberculosis, an undiagnosed case of hepatitis, let alone all the acute viral illnesses we think about. The only way we're going to deal with these is to do effective screening in an effective shelter and to have effective coordination, two of the 3 points that the Cox-Fletcher proposal bring forth to carry this through. There are plenty of organizations, including ours, that are anxious to work together and help us, but we need these resources to do them. I hope you'll consider this. I think it's very important. Thank you for your time.
Thank you. Next. It's getting harder and harder to say something new.
So first, thank you for this convening, and I want to thank Supervisors Cox and Fletcher for bringing this important matter forward. Frankly, I think it is the least that can be done. In recognition of this issue, the Alliance Healthcare Foundation, where I am the leader, my name is Elizabeth Dreiser, we voted before the holidays to engage, to convene, to advocate, and to fund solutions that get us to a more humane, more appropriate posture. I want to also acknowledge that the many fantastic, dedicated, wonderful organizations and human beings who you've heard from today, I think speak to our better angels. And I invite you to now take the baton and do your part. Thank you.
Thank you. Next, please. That was short and to the point. Good job.
Hi, my name is Tara Lawson-Reamer. I'm here as a resident and a concerned citizen of Encinitas. I first of all just want to thank Supervisor Cox and Supervisor Fletcher for bringing forward this item. There's no question that we face a humanitarian crisis on our border that's been created by the federal government, and unfortunately, it is the responsibility of the county to step forward and provide leadership to address this public health crisis and the homelessness crisis. And the only way to do that is by providing leadership, coordination, and resources in the immediate term. In the longer term, we do also need to be looking at how we prevent this crisis from continuing to spiral out of control, and can we follow the leadership set by other counties like Los Angeles, San Francisco, Santa Clara in providing legal assistance to individuals who are already legally in our country seeking asylum to ensure that their cases can be processed in a more timely manner. So again, in this current moment, and I know this is not a problem that we created, this is a problem we've inherited from the federal government, but it is our responsibility to address it and to do something about it, and really looking for your leadership to protect and defend the fundamental values of San Diego County in this moment. So thank you very much.
Thank you. Next, please.
Hello, everyone. My name is Bertha Gutierrez. I'm the founder of Bridge of Love Across the Border, and I'm in favor of Fletcher's proposition and also Cox's proposition today. And since April of this year, our group was founded by human rights grassroots folks here in our communities because of the specific things that we were seeing since the last caravan came in April. Fast forward to the exodus that came in, everyone was overwhelmed with the influx of all the migrant seekers and refugees seeking refuge here. So I saw firsthand the extreme need for assisting our fellow relatives that were coming here seeking refuge. So we couldn't help and send donations over fast enough. And I understand that because of that, the overwhelming need for support as the influx is coming in now into our communities. And I highly would like to thank ACLU Jewish Families, the organization, Rapid Response Network. I've been a witness to how much they benefited these efforts in supporting all of the families and refugees that have come across. I've heard so many terrible stories about the maltreatment from Border Patrol coming from the families, because we've been supporting and welcoming them and volunteering to also support these organizations that are already functioning and doing this. But so I understand the crisis now in our hands on this side of the border, because now it's coming through and it's in our hands to do the best thing that we possibly can do, and that is to help them reach their designations to where they're going. And I commend each and every single one of you that is here in support for all of your efforts and your volunteers, each and every single one of them that have come out of the comfort of our home to assist our relatives. Thank you.
Thank you. Next, please.
Good morning, Diane Jacobs and the rest of the Advisor Council. My name is Paul Ammons, and I am a full-time student on the East Coast, a native San Diegan, and part-time volunteer for San Diego Rapid Response Network and San Diego Organizing Project. So first off, I would just like to echo the sentiments of all the people that spoke today, and that each and every one of us, as well as the people that come to our shelter, we experience feelings of anguish and despair in seeing how each of these people are treated. And even the sight of an ankle bracelet just brings tears to your eyes. But also, just to highlight, there are moments of hope that the shelter has ensured for each of these people. There was one family that donated their flying miles to get a family to South Carolina during the Christmas season and ensured that they had that nice holiday that some of us just take for granted. So as a city, as advisory board, I would just like to encourage you to ensure that we ensure a right to the life, liberty, and pursuit of happiness for each and every one of our new neighbors that come through San Diego. Thank you so much.
Thank you. Next, please.
Hi, my name is Sally Hunt. I'm one of the founding members of the Immigrant Justice League. I think you probably heard from us yesterday when we had a press conference out on the steps here. I've been volunteering at the shelter 3 days a week for the last 3 months, and I'm familiar with the conditions there. Even though it's a well-organized place, it's quite small, and donations come in from all over, and they're piled in garbage sacks and covered with tarps. There's tents that help disperse the clothing and the shoes and the supplies to the families who arrive. It rains. Sometimes those tents and those tarps are not adequate. I heard Supervisor Cox say that there needs to be a federal solution. Well, hey, there ain't going to be no federal solution. The federal government can't even keep the government running. How do you expect them to solve this problem? A few months ago, this board decided not to support the California Family Values Act. Don't you think that sends a message? Talk about anti-immigration policies contributing to this problem. How much more anti-immigration can you be than to not support the California Family Values Act? The nonprofits who have been running this emergency shelter can't do it indefinitely. There has to be county, state, and hopefully federal help available. Thank you.
Thank you. Next, please.
As the next speaker is approaching, I'd like to invite forward our final two speakers in favor, Karen Bralian and Stephen Eldred. Sir?
Good morning. My name is Stepano Vargas. I'm a resident of Vista and a member of the Vista School Board. I'm here because I want to talk about being proactive. And I think we have the opportunity here. I'd like to thank Supervisor Cox, Supervisor Fletcher for bringing this up. And, wanting to be proactive, because these are families that are in our country. These are families that are going to be part of our public school system. As an educator, let's make sure that we set them off on the right track. Let's make sure that they have the services that these nonprofits are providing, to make sure that they are off on the right track from like the health services, the legal services, and that they get to their home. Because guess what? These are children that are going to be classmates of our children. These are children that want a better life, that are escaping poverty, that are escaping violence. And from an education background, education perspective, these are our children that who knows what potential they can have to contribute to make sure that we provide them the opportunities to reach their potential. And guess what? When they're in our neighborhoods, when they are in our communities, that they're better off and that we are all better off. So we have the opportunity today to support a proposal that takes us in the right direction, a proposal that is fair, and a proposal that is going to make sure that we set a model for other counties. Thank you.
Thank you. Next, please.
Hello, I'm Karen Brayling. I'm the Vice Chair of the Regional Task Force on the Homeless, and I'm speaking here as a volunteer, but I can, as an official person from the Regional Task Force, thank you all for your support of the point-in-time count. That's critical for our homeless neighbors, and I want to thank all the county employees who year after year step up and do that hard work. We could not do it without the county. As for this issue, I want to thank, and frankly, I'm very impressed with all of the organizations who have stepped up and truly been our first responders here and taken care of a situation that really not very many people would know how to handle, and been able to move out 95% of these 4,500 people out of our county into safe homes. Had they not stepped up, I truly believe that our other real first responders would have had to do that. Our police, our emergency room, our doctors, our firefighters, and our ambulances. And they would be wonderful, of course, but probably not able to move them out. And therefore, all of these people would be here and homeless. Thank you for your support of this proposal.
Thank you. Next, please.
As our final speaker in favor approaches, I'd like to invite forward our two speakers in opposition, Jill Bartow and Amy Sutton. Sir?
Yes, first, apologies if I'm glistening. It's a bit warm in the back of the overflow room. My name is Steve Eldred. I'm a resident of Oceanside in District 5, and here on behalf of the California Endowment to express our support for collaboration and partnership with the county and with others in responding to this urgent situation. The one thing I'd like to repeat from previous speakers is to express deep appreciation for the nonprofit organizations and the community volunteers, as the previous speaker said, have been the first responders to this emergency situation. The California Endowment has been proud to provide some of the startup funding for the Rapid Response Network to develop and operate that network, which was vital in recognizing the impact of changing immigration practices and the impact that was going to have both on the families affected and on the region as a whole. We've also been able to provide emergency funding last month for the operation of the shelters, and we're continuing to assess how we can help to partner with you and others to develop a long-term response while we attend to the immediate needs that these families are facing. San Diego, I think, has a well-deserved reputation for collaborative, multi-sector responses that improve the lives of people in our region. And this is a time that we need to do that. And whether these are residents here for 2 days or who intend to stay for the rest of their lives, they are part of our region, and they deserve us to work together to treat them with the dignity and respect that all families in our region deserve. Thank you.
Thank you. Next, please.
Hi, my name is Amy Sutton, and thank you for listening. I just wanted to let you know that I got this last night at In-N-Out. It's about human trafficking and how it can happen right under your noses. I want you all to please listen to me and look at all of their financials. There's no financials that are up front on any of their websites. I cannot verify any of their standings with the IRS. I want you to pay close attention to where these migrants are coming from. They come in droves. 15,000 to 30,000 are on their way right now. How convenient that they're asking for more help. Okay? Mark Lane, he has been involved with somebody who just went to jail last year Stephen Kwan, for tax evasion for $7 million, for hiring over 800 illegal immigrants in Irvine. Okay? Please pay attention to all of these people here that are trying to help these. I want to help. I want to help these people, and I feel bad for them. But they need to come into our country legally, not invading at 15,000 at a time. It is
Please,
not legal when they cross
excuse
through.
me, we'll stop your time. I would ask the audience to keep your thoughts to yourself, please, and respect the speaker, whoever it is, even though you may disagree. They deserve respect. Continue.
They cross through many, many states where they can seek asylum. But they all decide to come here to the United States of America. We have so many homeless people that are on the streets right now that need help. It's cold for them too. And we are not taking care of them. We don't have shelters for them. Thank you.
Thank you.
If Jill Bartow, Patricia Murphy, or Deborah Terry are present and wish to address the board, you're welcome to come forward at this time. I have called your name.
Hi, good morning. I'm not used to being on this side of the dais. I'm a school board member out in Cajon Valley, and I know most of you on the council, so thank you for having me. I agree with what Amy said. There's a lot of situations going on in our community. If you
I'm going to pause your time. Could you please state your name for the record?
Jill Bartow.
Thank you.
There's a lot of homeless and there's a lot of vets. There's a lot of families on our streets. And we are USA. We need to help our people first. There is legal pathways to come to the United States legally. I have friends that their families are waiting years to come here, to come across and seek asylum in droves and have organizations back them up without putting funding to our own homeless people that are here legally, that are our own community and our own citizens. I'm sorry, I don't agree with that. I think they need to be helped, but to ask the county for money, if they want to do it, open up their homes to these people to come into their homes. I know one stated that they did do that, but they're coming here with issues. About 12 years ago, I was in Georgia, and we were T-boned by a drunk driver, that it was his third offense, and he was an illegal alien here illegally on asylum and then never registered. That affected me for the rest of my life. He's now in prison, and every time he comes up for parole, I say no, because I know he will go back to Mexico and he will come right back here. And that happens every single day for hundreds of people. I have spoken to several of them. Unfortunately, we are still alive, but a lot of the people are not alive. Look at the police officer up in Newton. Because this man was an illegal, here illegally, his life is now taken. And we need to think about that and think about providing community services to our own people first. Thank you very much.
Thank you.
Chairwoman Jacob, that concludes public testimony on this matter.
Thank you. First of all, I'd like to thank all of you that have taken time to be here and to present your views to the board today. And thanks also to all the organizations and the work that you do. You do excellent work out into the community. I'd like to ask council a question, and then Nick, to kind of help frame our discussion on this issue. First of all, the council, what is the county's legal obligation or legal responsibilities in this area?
Chairwoman Jacob, the county has legal authority to take the action that we are talking about today, which is to identify property for a shelter, but we don't have a legal obligation to do so. In this arena of dealing with the migrants that are coming across, the point at which the county would have some responsibility is if we have some kind of a public health issue. And at that point, the public health officer then would need to figure out what to do to address that. The public health officer is currently doing that by placing public nurses in the shelters. to be able to try to monitor, to make sure what's happening as far as public health is concerned. So we do have a potential responsibility, but when you talk about the actual providing of shelter and the providing of the shelter, we do not have a legal obligation to do that, although we do have the legal authority.
Thank you. On the health issue, because a lot of the speakers brought that up, I know that the county has been involved very proactively trying to do some vaccinations and some other things. Nick, are you prepared to explain to the board and to the audience what the county has been doing and what the county will continue to do in that area?
Yes, thank you, Madam Chair, members of the board. As it was discussed, there's been about 4,500 individuals that have come through the shelter network. Our involvement from the beginning was to provide some assistance to the shelter partners. But in December, we actually stepped up with more of our public health screening with our nurses and some of the social workers. We have conducted now over 1,600 public health screenings at the network. One of the issues that for us in protecting the public health that's extremely important that was called out was the issue of varicella, chickenpox. And this is a very highly contagious disease, and that is why we are called into public health, because since October, there have been 9 cases of chickenpox. We get on average about 2 cases a year. So this is an alarming number to have, and it is highly contagious. We didn't have 9 cases until it was about almost 9 years ago. So that pauses for a great concern that if we don't provide the services to these individuals and families, we can expose ourselves to an outbreak in terms of varicella. In addition, our assistance on the social work is to make sure that any families that have any more urgent needs, working now with La Mestra and the San Ysidro Health Partners who are there. We have brought in UCSD Medical Center and Catholic Charities, working with Jewish Family Services to ensure if there's any urgent care that the families and the children are seen for urgent medical care. But our primary role has been from public health is that screening and that assessment. And we have actually set up a shelter screening process there at the site with our partners.
And moving into the future, what are the plans? We certainly don't want to get into the same situation we got into with the Hep A, the delay in declaring a health emergency, and we hope we don't have a public health emergency as a result of this, the migrant issue. But what are you prepared and the county team prepared to do in terms of preventing a health crisis?
In 2 ways, Madam Chair. One, we will continue to provide those public health screenings. It was mentioned in December there was a larger number of families that were released and they had to get to a second shelter. Our concern is if we don't have a central location where we can treat the families, then families may be scattered. And it was already mentioned that they were in multiple sites. We prefer, obviously, with our public health resources to be in one central site we could provide that screening. We will continue that screening ongoing. That is to protect the public's health. But the second issue was preventing homelessness. And that is a very key issue because that is something of a mandate from your board of how we're trying to avoid any additional homelessness and helping families be stabilized, this asylum-seeking families or children stabilized so they can move to their host community that don't then necessarily reside in San Diego and add to the burden homelessness that we're trying to address is extremely important. So that's another part of our function working with the partners in the community.
Thank you, Nick. I appreciate that. I just want to make a couple of comments before I go to Vice Chair Cox and Supervisor Fletcher. I do have a lot of compassion, deep compassion for families that are seeking asylum. This is not a new issue. It's a new issue because of the failure of our federal government and particularly the Trump administration for not doing their job. Because we've never had the situation at our border that we've had before and those that have coming into this country to seek asylum. And I don't mind banging on the administration. Call it as it is. But we wouldn't be here today. We wouldn't even be discussing this issue. But because of the failure of the Trump administration and the federal government specifically. I particularly have a lot of compassion for the kids. Being a former teacher, the children particularly are put in a situation in their home countries where they faced many trials, many tribulations. I have a large Middle Eastern refugee population in my district, and I understand some of the trials and tribulations of those countries that they're in, and probably there's a lot of similarity to what these families have faced in their home countries. I would only hope that, as we had a civil war years ago, that they would take on the fight and try to change the country that they're in and the leadership there. However, in the meantime, I am sympathetic to their quest to seek a better life. I mean, we'd all like to do that. As I sat here and I listened, and the compassion and the amount of energy that has been put into this effort, I can't help to think, what about our homeless veterans that are on the street? They're our own people. And I looked at some statistics, and it's kind of alarming to me because I think we've done a lousy job in dealing with our own, and specifically our homeless veterans. Let me give you some stats we looked up. The county currently has 1,312 homeless veterans. We have precious resources and many priorities, but if you look since just last year, since 2017, there's been a 24% increase in our homeless veteran population. And we're not talking about homeless seniors right now either, which is another population, just the homeless veterans. I have two issues here that I want to lay out on the table, and then we'll have, I'm sure, some good discussion on this issue. Number one, this is a federal issue. Clearly, it's a federal issue, and as I mentioned earlier, it's a failure of our federal government to adequately address the issue, and that's why we're put into the position that we are right now. Secondly, I believe our priority should be take care of our own first, and I gave the example of the homeless veterans. When we talk about resources and spending county resources, that means staff time. It's not just the money. It's the staff time and the energy that we put into an issue. And it is, to me, all about priorities and how we deal with priorities. I think we do have a potential health crisis here, and I don't have a problem dealing with that, but at the same time, we need to push hard on the federal government to reimburse the county for the health issues and the money we're expending, because it's not a problem of our making. It's a federal problem. I don't have a problem if we want to work with the state, you want to go back with the recommendations on the armory issue. I mean, Supervisor Gasper already laid out an issue. But I do have a problem with the rest of the recommendations as they are today. So I may be the only one that holds that position today. I don't know. But another issue I'd like to bring up, a couple of things. I think that if we go forward with all the recommendations as recommended, we're opening up more problems. In the paper today, there's a story about 50 migrants refusing to leave a private 2-story warehouse just across the border in Mexico. Now, these are problems the Mexican government is having. I don't want those problems to come on our side of the border. The Mexican government, in this case, attempted to shut the facility down on Friday last week. Mexican health officials deemed the facility unsafe and determined that there are no conditions to guarantee health and that people are at grave risk. To push the migrants out, Mexican officials have cut running water, electricity, and other services, yet the migrants are still refusing to leave. Instead of forcing people out physically, the article goes on, the Mexican government has asserted that anyone who steps over a police barrier will not be allowed back in. They're having big problems on the other side of the border. I don't want to invite those same problems here. One more point I'd like to make. There was an article that I read, and it gets to why are the migrants coming to our border in San Diego County and traveling some 1,300 miles farther than McCain, Texas? And that's a really good question. And in this article, it goes on to state that there's basically two reasons. One is that California is a sanctuary state, and the second reason is the Ninth Circuit. And those are the two reasons they're coming in here, and it's a much shorter distance to McCain, Texas, but yet they're choosing to come this far, and as the article stated. So I'd like to do something, but not everything today on this issue. And I'll open it up now to Vice Chair Cox, and then up next would be Supervisor Gasper.
Thank you, Madam Chair. I want to start off by thanking all of those people that came down today to speak on this item. It is an issue that has presented itself to this Board of Supervisors. You know, sometimes in the years I've had a chance to be on this Board of Supervisors, we find ourselves in a situation which we have problems that are presented to us that we had no involvement in creating, and yet we've got to make decisions in regards to how to appropriately address those issues and problems. You know, county governments are a creature of the state of California. We're subservient to the state of California. We're subservient to the federal government. We're kind of the layer in between those two governmental agencies that find ourselves in a situation today where we have the federal government that has made policy decisions in regards to how migrants will be handled. So immigration and customs enforcement have set up their process that they have, where they basically listen to presentations from immigrants that are trying to seek asylum. And the federal government has made a decision now that they will, those that they have deemed have probable cause for seeking asylum, at least families, will be allowed to come into the United States on a temporary basis until their cases are adjudicated, and predicated on the fact that they have somebody to be a sponsor. And those sponsors can be, and frankly are, I think of the 4,500 people that have come through already under this program, they've been scattered across the United States. They're here in San Diego County for 24, 48, probably no more than 72 hours before they are hooked up and provided direction to their sponsors. We have a state of California that has taken an action, whether you agree with it or not, to the fact that California is, quote, a sanctuary state. I'm not exactly sure what that means, but what it tells me is the state of California also has some responsibilities to assist in addressing the population that is coming into this country legally. They're not illegal immigrants. They are people that have, by the federal government, ICE has basically determined, okay, we're going to let you have a chance at a future date and time in a immigration courtroom anywhere in this country where they're assigned to plead their case and why they should be allowed to change that status from an asylum seeker to a refugee. Again, we have no role in any of those processes. But we have a situation which is unique, frankly, to San Diego County and Imperial County, at least in the state of California. It doesn't affect the other 56 counties in the United States, where we have hundreds on a daily basis of individuals, families, again, women, and children, and husbands with these children, that are being basically dropped off. Now, I think there's been some better coordination over the last few weeks between Immigrations and Customs Enforcement, working with the volunteers and the community organizations that are out there to have those individuals delivered to the temporary shelter that has been set up. So I think it's a little bit more efficient. But, you know, until a couple of weeks ago, those families were being literally dropped off in front of McDonald's, in front of the outlet center, basically to fend for themselves. People that in many cases don't speak a native language here. They may even be have an indigenous language that nobody here would probably understand. And so we got to come up with a better system, because the alternative is to basically abdicate our role as a public health provider to ensure that these individuals are coming into this country, that they're getting the proper screening. And as staff has indicated, we've done about 1,600 screenings. But it also tells me that if there's been 4,500 that have come through, there's been close to 3,000 that didn't get that screening. And, you know, we've gone through a crisis with the Hep A not that long ago. We've got legitimate concerns that are being raised about the possibilities of people being infected with chicken pox that don't have the proper immunizations. We have an issue here that we have to deal with. And I think the recommendations that have been laid out in the board letter are a reasonable approach. Our chair last year, Kristen Gaspar, I think rightly so, basically calls upon the state of California to provide a contracted entity to oversee shelter operations, to supplement the work that's being done by Jewish Family Services, by ACLU, by the San Diego organizing project, but it's the San Diego Rapid Response Network. Thank you. The good news is we got a lot of community organizations that are actively involved in doing a tremendous service. But you know what? It shouldn't fall upon those nonprofits to fund this operation. That's why recommendation 4, we're asking the state and federal government to figure out a way to reimburse the county for our costs, for the nonprofits, for their costs that they're incurring in providing these services, which are absolutely essential if we're going to address this problem before it becomes an even bigger crisis. So I am hopeful that my colleagues on the Board of Supervisors will see that these are reasonable recommendations. If you want, if it's easier to go through these one by one, we can do that. But in order to get a discussion started, I would move that we accept the recommendations presented in the board letter, and I would certainly hope I can count on my colleagues' support to move this effort forward. That would be my motion.
There's a motion. There's a second by Supervisor Fletcher. Supervisor Gaspar.
Thank you very much. Well, first and foremost, as a mother of 3, my heart breaks to see any family suffering and in this situation. And I spend a great deal of my time, both personally and professionally, as a public servant, seeking out ways to help our most vulnerable populations here in San Diego, from those struggling with substance abuse and homelessness to the formerly incarcerated, and those whose lives have been torn apart by human trafficking. What we're seeing here, this is an international humanitarian crisis, and it certainly necessitates the attention of governments across the world, including the United Nations. I want to take a moment again and thank our community members, many of whom are in the chambers today. Our organizations are nonprofits, the faith-based community. You have stepped up and you're doing your share. In fact, you're doing more than your share, and you should be applauded for doing that, because not everybody's doing their share. I want you to know that I've been both proactive and very persistent long before this board letter was ever issued. On November 16th, I wrote a letter on behalf of the County of San Diego as the chair to Governor Brown, insisting that the state provide food, short and long-term housing, travel assistance, medical care, and case management to the flood of asylum seekers and illegal immigrants who have made their way to San Diego County. For the record, I would like to read this letter that I issued to you now. It's dated November 16th to the Honorable Edmund Brown, Governor of the State of California. As the chairwoman of the San Diego County Board of Supervisors, I am writing you about the impending humanitarian crisis at the border. It's our understanding from Customs and Border Protection that 2,800 immigrants from Central America are staged in Tijuana, awaiting processing for asylum claims at ports of entry within San Diego County. Furthermore, an additional 2,000 immigrants have arrived in the past several days to weeks, and an additional 5,000 immigrants could head toward Tijuana with hopes of entering the United States through San Diego County. According to Customs and Border Protection, single males and unaccompanied juveniles are prioritized for detention and sent to other parts of the country, while family groups are simply dropped off in downtown San Diego when charitable shelter beds are unavailable. Our local non-governmental organizations have reached shelter capacity while thousands of immigrants are arriving at our border, and Customs and Border Protection is processing 60 to 100 people at the border per day. Those numbers could double in the coming days to weeks, and this does not even include the immigrants who enter our country illegally between ports of entry. I'm writing to call upon the state to provide food, short and long-term housing, travel assistance, medical care, case management to the flood of asylum seekers and illegal immigrants who are making their way to San Diego County. Customs and Border Protection also stated there is no way to verify that immigrants claiming to be family units are actually blood relatives. Family units are dropped off on a regular basis by U.S. Immigration and Customs Enforcement at a bus station in downtown San Diego. According to Customs and Border Protection, it is widely known among immigrants that single males are detained while families are set free in the community. I am concerned about child trafficking and the implications for public safety, as the criminal backgrounds of these individuals and their countries of origin is unknown to both federal and local law enforcement. I call upon members of Congress to fix this abhorrently broken immigration system that is resulting in the crisis at hand, and the state to bear the responsibility of providing basic necessities to migrants it is publicly welcomed. This is not a short-term issue. Customs and Border Protection has informed us that thousands more Central American immigrants are headed for the United States. Thus, immediate and long-term actions are needed by both federal and state policymakers to remedy this situation. 2 years ago, the state opened and staffed an armory that served as a temporary shelter for Haitian immigrants who were similarly being dropped off by ICE in downtown San Diego. Please let us know at your earliest convenience of the state's plans for sheltering the thousands of Central American immigrants who will be released in San Diego County over the coming weeks and months. Now, that letter was dated, of course, in November. And when that letter went unresponded to by the governor, I tried again. And this time, I brought along with me Mayor Kevin Faulconer, Chula Vista Mayor Mary Salas, National City Mayor Morrison, and we issued a joint request to Governor Brown insisting the same things that I've just read to you in this letter. Unfortunately, our pleas for assistance to Governor Brown were all met with a single bureaucratic no. Perhaps the new governor will come to the table. We welcome the new governor to the table. We need help. But even in the face of no, the County of San Diego has been and is continuing to work on both sides of the border. We are providing much needed doses of vaccines and health screenings with the cooperation of Tijuana health officials, and we thank them for that. The county is also working closely with the shelters in the city of San Diego, currently managed by nonprofits, thank you very much, to ensure public health, food, and safety. The practice of dropping off families, many with young children, at a bus stop or in our downtown, or telling them to walk to a McDonald's is simply inhumane, and we all know we can do much better. These are families who have been granted permission to be here. They are the tired, the poor, the huddled masses yearning to breathe free, and it's our duty as a society to help them. I remain very concerned, as mentioned in my letter, that these children who escaped unimaginable horrors in their homeland will come here and be unwittingly swept up into the commercial sexual exploitation of children that's happening right here in San Diego. The human trafficking trade is close to $900 million alone annually in San Diego County. Our county has the second highest population of victims and survivors in the human trafficking area in the entire country. Sadly, almost a third of these victims and survivors are immigrants. They are being preyed upon. There are the implications for our public safety, as criminal backgrounds of these individuals and their countries of origin is unknown to both federal and local law enforcement, as mentioned in my letter. Indeed, our federal government has an obligation to fix our broken immigration system that is directly resulting in the crisis at hand. However, the state of California does bear the responsibility to provide for these basic necessities to immigrants it is publicly welcome. These individuals who have followed a proper process. This is not a short-term issue. Immediate and long-term actions are needed by international, federal, and state policymakers to remedy this situation. I know that the county remains willing and prepared to provide appropriate care for these men, women, and children, but we cannot do it alone. At a time of crisis, the state and the federal government is noticeably absent from this important, what should be, partnership. And that partnership also does include the work that's being done in our communities by the wonderful nonprofits, as mentioned earlier. I want to make one thing very clear, as there are groups out there that use fiery rhetoric and misinformation for their own political gain at the expense of rational discourse and good public policy. Today's crisis has nothing to do with the decision that the board made to oppose the sanctuary state. Today, we're talking about families. Families who have a right to be here, families with young children, families who need our help. Consequently, I am supportive of the recommendations in the letter, items 1, 2, and 4. In fact, as I was doing my research, I came across a board policy which was sunsetted just before my time on this board. That policy actually granted our CAO the authority to seek temporary shelters during inclement weather. Essentially, the same thing that we're granting today by this action. I want to outline some concerns and perhaps offer a suggestion on item number 3. And so I would ask that my colleagues bifurcate the issues, and perhaps we bifurcate out item 3 and we can talk about that, because I am in support, again, of recommendations 1, 2, and 4. Now, our speakers today have adequately covered the federal government's deficiencies in this crisis, but I want to talk for a moment about the state of California. It is the responsibility of our state to provide these shelters, and they are outright neglecting to do so. That's a large reason why we're here today. And while I appreciate the efforts of my colleagues to provide additional county alternatives in this area, it is not our role in the partnership, and picking up for the slack of the state will ultimately take away precious resources from what is our primary responsibility at the county level. As a county, it's getting quite frustrating. We continue to be the bank for the state of California. We often absorb their responsibilities when they neglect to do things, and when we do that, we can never unwind it. We often wait for a large check to come in the mail that's either significantly delayed or, guess what, it never comes. It's unacceptable. At one point, we had over $60 million in outstanding state dollars for 15 years until the state paid. So yes, it does frustrate me when I hear that the state has a surplus, because they are leaving items unattended to. Now, I can certainly understand that the concerns that have been expressed to me by members of the community who believe we need to continue to focus our resources on the thousands of homeless San Diegans. And perhaps, as one speaker pointed out, there is a way to coordinate funds, property, assets. A speaker brought up a good point today. At the moment, the city's homeless shelters are not operating at capacity. Now, let's consider for a moment that instead of creating a new bureaucracy, redundant services, why not consider co-locating services for these needy families and providing the same services to both under one roof in our existing shelters? This would provide conveniently located shelter and services for migrant families, while the working group aggressively seeks longer-term solutions with the county, state, and federal government all at the table, all stepping up to fulfill their responsibilities. On recommendation number 3, I would simply ask that this board give our staff the opportunity to take a deeper dive and give us a better idea of what actually could be done within our existing emergency shelter system if we were to coordinate our funds and our assets and perhaps that component of public health before we decide on the development of a brand new site and bringing on board brand new services. So my recommendation on 3 would be to simply explore that as a concept before we pick and choose a site to operate a brand new shelter. So that's my issue with 3 and why I'd wish for that to be bifurcated, but happy to support again 1, 2, and 4.
Thank you, Supervisor. Next up, Supervisor Desmond.
Well, thank you, Madam Chair. I don't need, I guess, to get on the federal government and state bashing party. I think they've been handled quite well. I do want to thank all the people of the response group that stepped up and filled in the need and the gap that was created by the state and the federal government. I do also think that we should be taking care of our own homeless folks first. We still have over 8,500 homeless people in this county of San Diego, a lot of them with behavioral health issues, which I think is they can't get jobs, they can't get housing. And I think that they're even in a worse predicament than some of the asylum seekers. But I do appreciate the compassion that you have. And, unfortunately, we are the doorway to California, San Diego County. I said Imperial County. But we're treated like a doormat by the federal and state governments. They're sanctuary city, the sanctuary state declaration, yet they put nothing behind it to accept or help in this asylum seekers. So a lot of this that's being presented today, I think, is already underway, and we probably really didn't need this particular item coming forward. But it is what it is, and I would like to offer a few suggestions on some of these items as well. Item number 1, to direct the Chief Administrative Officer to continue to pursue armories or other state properties within the Governor's Office for assistance in sheltering this population. I'm fine with. I think that's a good idea. The state should be stepping up. I don't care if it's armories or other items or assets that they have. On item 2, this is the formal consideration of a task force with two presenting supervisors, Cox and Fletcher, on that task force. Technically, we don't really need a task force. Two supervisors can go out, and it's not a Brown Act violation, and already go and ask and talk with the federal, the state, and the regional stakeholders. But since you've asked for a formal task force, I think then we need to treat it as such, and I think it has to have a sunset, it has to have sustenance, and it also has to have participation. So I think as far as the task force itself, I think it should sunset within 90 days. You should be able to get some actions done within 90 days if the other entities are very serious at all. And I'd also like to have minutes and attendees get that information provided to the Board of Supervisors. And primarily, I want to make sure that the attendees are other elected federal and state officials. I don't want their staff members. I want to make sure that they're invested. And so I want to have minutes taken at these meetings, and I want to know who the attendees are at the meetings. On item 3, and I agree with Supervisor Gaspar's recommendation of looking at all different types of potential opportunities. But I think before occupancy of any county property, that it comes back to the Board of Supervisors for approval. That this task force doesn't have that authority, that has to come back to the Board of Supervisors. And if we have to have an emergency meeting or a late night meeting, I'll drive the hour down from North County and do that. And then the same thing on item 4 is to also, on item 4, I'd like to have any additional resources or dollars spent beyond what we're already providing through Health and Human Services, that also comes back to the Board of Supervisors for approval. So that would be my recommendation to the makers of the motions, to have the sunset, the minutes, the attendees, and then Board of Approval on items 3 and 4 before going forward on any of those items. Thank you.
Thank you. Supervisor Fletcher.
Thank you, Madam Chair. Just to touch on my perspective on a few of the concerns that have been raised, this is not a California unique problem. If it were, El Paso in Texas, which certainly doesn't have the same state policies the state of California has, would not be experiencing the exact same situation. And so I don't know that we can credibly claim that this is unique to us because of what's happening, because it's well documented what's taking place in Texas as well. I don't know that if we vote to talk about the issue or to try and get the state to reimburse us, or if we vote to make available a vacant building, that the federal government's going to open the borders and change our policies. I think we're doing our small part in where we are to do what we can within our power. As it relates to the homeless issue, I'm very concerned about the homeless issue, and I'm very concerned about the challenges and problems we face here in San Diego. And I was particularly heartened by the homeless advocates who are not involved in asylum-seeking issues, but the advocates who dedicate the entirety of their professional existence to tackling that problem with us, who showed up today to testify and speak that this action helps address the homeless issue, because you know that the quickest way, in the Marines, the first thing we were taught was stop the bleeding. When you're in a trauma situation, you stop the bleeding. And so actions to stop new folks potentially from coming into our homeless system, I think are very important. And I agree we should take care of our own. And in America, when you come here and you have legal status, I believe that makes you our own. And I think that's important. Human trafficking is an incredibly important issue, and the most dangerous thing we could do from a human trafficking standpoint would be to have women and children roaming the streets of San Diego without a safe place to go, without a central location. And so I think that is important. On the notion of we shouldn't go it alone, I 100% agree we shouldn't go it alone. And I think that is central and key to what Supervisor Cox and I are talking about, which is that working group of the state and the federal and the county governments coming together for how we do it. I couldn't agree more. That has to be there, and they can't be absent from that. I don't have any problem with minutes and making sure that people show up. Hear Supervisor Cox's thoughts on that as well. And on item 4 is designed to get the county more money. The purpose of item 4 is so that we pursue state legislative action so we get reimbursed for what we're already doing. And I think that is vital. And today we heard from so many folks who have given so much of their life to try and address this issue. And what they've cobbled together has been a heroic feat. But they've moved locations 5 times, from church to shelter to facility. They're spread between multiple areas. And that presents itself as a public health risk. Not having one location they can go. Now, I don't care where the location is. The city of San Diego stepped up and offered a location in Alpine. Alpine is better than them being stuck at the El Cajon bus station. Maybe that works. The state, we have a new governor. Maybe that would work as well. All our issues are doing is to identify, is there the potential for something that in the event those don't work out, that we can do. The state has also provided hundreds of thousands of dollars in emergency funding to help fund the operations of the shelter. Now, if as a board we would rather provide the hundreds of thousands of dollars to fund the operations of the shelter, I'm sure some other jurisdiction would probably find a location for us. But it seems easier if we can work out a way to take a facility temporarily that we aren't using in order to try and move that forward. And ultimately, we heard from individuals who are doing everything they can. We heard from organizations that are doing everything they can. I know that the governor has communicated he's willing to do more. I've talked to legislators that are willing to do more to see how the state can better partner and reimburse what we're doing. And so now I think it falls to us as leaders to say, what can we do? What can we do? And the reality is we have the capacity to help. We have the ability to help. And I think setting aside humanitarian issues and moral issues, I think we have the obligation to help. And so, I think that there's something that we can work out here, and it would just be my hope as a board that we don't abdicate shouldering our share of the load, not taking it alone, but working with the city and working with the state and working with the nonprofits that have spent hundreds of thousands of dollars of private donations in a public-private partnership in a collaborative way where we're working with these other entities. Because at the end of the day, if you have a public health crisis, an outbreak, no one's going to come back and say, well, you know, it's the federal government's fault. We know where they're going to come back to. And so I would like for us to discuss and talk about how we can get to a place where we're doing our part to be part and parcel with all the other entities that are engaged today. Thank you.
Thank you, Supervisor. I'd like to bifurcate the motion. Please, if you would, we'd like to get done, allow you to go have your lunch and whatever. So if you'll just hold off here, we're going to try to reach agreement on these issues. So I would like to bifurcate the motion, if it's okay with the maker and the second. And we'll take an action on each one because there were some recommendations on some of the others that might bring some compromise and some consensus on some of these items. Number one.
Yeah, Madam Chair, I would move that we direct the Chief Administrative Officer to continue to pursue armories or other state properties with the Governor's Office for assistance in sheltering this population.
Second.
There's a second to that. Any discussion? Please vote.
Chairwoman Jacob, that motion passes unanimously with all board members being present and voting aye.
Okay, 1 down, 3 to go.
Could I continue?
On number 2, let me try to summarize what I heard from others. On number 2, I heard from Supervisor Desmond. He talked about, and I'll add this in, coming back to the board within 90 days with a report, taking minutes, a list of attendees, other elected officials. Did I miss anything?
I think his intent was the subcommittee exists for 90 days.
I want a sunset of the task force in 90 days.
That's it.
So during that time, that we get the minutes and updates of any meetings, but a sunset of in 90 days.
Okay, there'd be a sunset in 90 days. Within that time, are you agreeable?
We get the minutes and attendees of all those meetings, whatever meetings take place within the 90 days.
To report back to the board at a board meeting, or just to report
No,
back?
it can just be informational. It
Okay.
doesn't have to come back to the board meeting.
Good enough. So would that be your motion?
Yes.
Okay. Madam Chair, I'd ask Supervisor Desmond if you might consider 90 days is awfully quick in terms of getting it up. We want to get elected officials there, coordinating schedules and calendars and those types of things. I'd ask if you might consider a 6-month window with us reporting back progress at the 90-day mark, where certainly the board, if not pleased, could do away with it. But it is something that the folks that are involved, the issues, the advocates, the other folks, if we had a 6-month window with a report back from the subcommittee at the halfway point, along with minutes and attendance type thing, I think it would be a little bit more workable and easy to try and accomplish what we're trying to accomplish.
Is that okay?
And I concur with that as well. I
I'm
have
not going to support it.
real big concerns that there's just absolutely no way you're going to get the elected officials that we need at the table within that time frame. I mean, it took them 30 days just to tell me no each time I wrote that letter. So if we could be a little bit more patient with it, I concur with the supervisor that it's much more reasonable, in my view, that a report back be put in place, and 6 months even is going to be tight.
So the suggestion is a 6-month sunset with a 90-day report back. I would even ask on that issue that, and I'm willing to compromise for the sake of a new era on the board and working together. I think there's some good suggestions. I'd like to make sure that if there are any county resources that are expended on number 2, that we get a report on that too. So.
Okay, so basically we would create the subcommittee with a 180-day sunset with a 90-day report back, and as we have meetings, we can provide minutes of who attended and points of discussion.
Just a comment, if I could. I'm going to stick to the 90 days. I'm not going to support the 6 months. If you give politicians 6 months, they're going to wait to the last minute. And so I think there's urgency here, and I think that this has been going on already since December. I would stick with the 9 days. If after 90 days the board votes for more time, okay. But I think if you give people more time, they're going to take it. So I'm not going to support the 6 months.
So what does the motion say?
It's up to you. I mean,
Mr. Maker of the motion?
it's only one.
And I'm fine with it I'm fine leaving supervisor in the dust. I'd like to have him on board. I just feel quite strongly. I'm sorry, we're too new to act like that. But I think that
Which supervisor do you want to leave in the dust?
Oh, just Desmond. Just Desmond. It
Happy
could
to be there.
A poor one. Yeah. I just think I understand what you're saying, but I also understand that these aren't necessarily legislators, that there are people that are traveling between here and Sacramento, between here and DC. 90 days is, it's unreasonable. I think once your schedule gets up and running too, you'll find that it's going to be tough for you to meet within that time period. So I think that the report back is the reasonable one, and so I'd be in supportive of trying to put it in too short of a time frame. You'll lose me at that point.
Well, why don't we do this? If we can have a report back in 90 days and there's no progress that's shown, then we'll sunset it in 90 days. So that'll put everybody's feet to the fire to get something done in 90 days. And because I'm inclined to agree with Supervisor Desmond on this issue. I wasn't going to vote for it in the first place because I felt it was more important to take care of our own and focus this kind of an effort and what we're seeing in this room on our own folks, our homeless vets, our homeless seniors, and others that are in this county as a priority issue. But for the sake of compromise and trying to get somewhere on this, I want to be realistic. I want to be fair also.
Would progress shown be scheduled meeting dates, future follow-up? Is that progress in your view?
Action recommendations, something of substance, not just scheduling meetings, not just the ministerial kinds of things, but some
So if we came back in 90 days with some progress made, then the working group would by its nature continue.
Yes, I mean, to me, that would be a fair compromise.
Okay.
It's going to have to show some action other than just establishing meetings.
So would the intent then be that we would have a report at 90 days, and if there was no definitive action, it would cease to exist, but it wouldn't necessarily, would it come back to the board for board further action, or just a report?
I'd like to see it come back to the board.
Yeah.
Let's have it come back to the board.
I have a hunch we'll just get mushy and extend it, but okay.
Well, we may not get mushy and extend it.
Okay, just my hunch. Okay.
Okay, so it would
We
be,
need recommendations. In 90 days, we need some recommendation out of this task force. So that puts everybody's feet to the fire. There is a sense of urgency on this issue. As I expressed before, I think the most urgent issue is a potential health crisis, and we want to avoid that.
I guess I would like to see participation of resources from the state and or federal government is what I will be looking for in 90 days.
okay, so then,
I'd support that.
Okay.
in essence, we're saying that we would create this committee for 180 days with a 90-day report back, and if there's no substantive action during that 90 days, then the subcommittee would wither away and die.
I agree.
Okay?
Okay.
Or cease,
And
maybe, yeah,
and we're
cease to
basically
exist.
and we're basically focusing on federal and state, not county, federal and state.
Participation.
Agreed?
Well, I think it's important to outline what the county's doing and what we do have at the table, because we do have resources already at the table I can't remember the exact figure of what we're currently spending, but to provide those health screenings and the vaccinations, I think is incredibly important to help ensure that we don't see a public health outbreak crisis.
County will be a part of it.
Sure.
And it says in here,
Right.
address short-term, long-term. I think it spells out the task of the group. And so if we have a 180-day window to work on it with a report back in 90 days, that's fine by me.
Okay?
Okay.
Everybody understand what we're voting on?
Mm-hmm.
Okay, please vote.
I'm going to ask to clarify the motion just for the minute. The recommendation is that the subcommittee be established for 180 days and that at 90 days there be a report, and if there is no substantial action, the subcommittee would cease to exist.
Substantial action or recommendations.
Okay. That's fine.
Correct, and then with minutes, attendees, and
Are the minutes and attendees
Yes.
the
included in the motion?
Well, I would think every time the the task force meets, we could provide a summary of what happened and who was there.
Yep.
And I think that can be a part of the motion.
And that would not be at board meetings, that would just be.
No, it'd just be a written report provided.
I guess I'd like the attendees, not
Yeah.
the officers.
Part of the minutes.
Yeah.
Yeah.
And the focus of the group would be federal and state officials. The county, we understand the
Plus
county will
city.
be involved.
And city.
And the city.
And the city. And the nonprofit and advocacy groups.
Okay. Okay?
Okay.
Please vote. Does the clerk understand the motion?
I would again say that the motion is that the subcommittee be established for 180 days, that at 90 days there be a report. Should there be no action or substantial recommendation after that 90 days, the committee would cease to exist, that the subcommittee produce minutes that include attendees.
Got it.
Okay, please vote.
The motion passes unanimously with all board members being present and voting aye.
Okay, Madam Chair, if it's okay to continue, I would move that we direct the Chief Administrative Officer to identify county property for a potential temporary shelter that the state or applicable entity could use to shelter asylum-seeking families, and that we ask the Chief Administrative Officer to look at all potential opportunities and to bring back any identified properties or recommendations to the board for action.
I agree with that.
There's a second on that?
I guess I just want to clarify that's before occupancy of those items.
Yes.
Of those
I have a problem with that. We've already taken action as a board, as you know, Vice Chair Cox, that affordable housing on county properties has been our priority. We've already identified, I've seen the list of sites, and a lot of those sites are for affordable housing. I don't want to, and we've approved them for these sites too. I don't want to slow that down. I'm going to vote no on this one.
Well, just
Because again, I think this is a federal and state responsibility. The feds and the state need to come up with federal and state property. We have a better purpose for our county properties that we've already identified.
Just to respond to that, again, the operative word here is temporary. We've got properties that are being planned for future development. Some of them aren't even going to be started for 6 months or more. So if in the interim, since we have a facility right now which is providing shelter for the asylum seekers, but they have to be out of there, I guess it's by February 7th, if we can provide some bridge location for a month or 2 months or 3 months, and it doesn't adversely impact any of the efforts we have to provide permanent affordable housing, why wouldn't we want to try to accommodate that? And again, since these are people that are coming in for 24, 48, 72 hours at the most, it's pretty easy for us to say, okay, to the operators, which right now, again, is a nonprofit community that's operating these, as of March 16th, you cannot accept any more temporary housing. It seems like we've got a lot of ways we can control the duration if we were able to come up with a temporary location.
I would only refer you to the story that was in the paper today that I read excerpts of the problems they're having in Mexico, where the migrants have refused to leave. I don't want that same situation.
Madam Chair, we're talking about totally different populations. The migrants in Mexico are trying to seek asylum. These are people that have been given asylum temporarily, and they're only here for a brief period of time. So I think it's a totally different situation.
Supervisor Fletcher?
I believe we have a motion on a second on an issue Supervisor Cox has outlined, and I'm prepared to vote when the board's ready.
Anybody else on this issue?
To repeat the motion.
Well, as restated, my preference would be to explore our existing capacity, and that has not been explored to date. And I think the chairwoman has brought up a good point. We have RFPs out on a lot of the county property already, which could be problematic. But again, I think that it's a big miss if we're not leveraging our existing resources and finding a way to be more creative with our existing capacity before establishing new capacity. If it is the case that everything's full and it can't be done, someone's going to need to show me it can't be done. To date, nobody's been able to point out that it can't be done.
Which is why I believe Supervisor Cox amended his motion to bring it back to the board before any property would be made available.
And to look at all potential opportunities, which could be the ones you had mentioned.
Okay, everybody had their say on this one?
I just want to hear the motion from the clerk.
I'm going to ask the Vice Chair to say the exact words.
Damn. Okay. It would be to direct the Chief Administrative Officer to identify county property for a potential temporary shelter that the state or applicable entity could use to shelter asylum-seeking families. To also look at all potential opportunities and to bring back any of those opportunities or any of those potential sites for board approval.
Okay, everybody understands the motion and the second. Please vote.
Chairwoman Jacob, that motion passes with Supervisors Jacob and Gaspar voting no, all other supervisors being present and voting aye.
Okay,
And
on number 4.
the last one, to direct the Chief Administrative Officer to work with federal and state delegations on legislative policy, including funding resources that would allow the county to provide ongoing services to asylum-seeking families. And again, we're talking about health services. And I would include in that, incidentally, and receive reimbursement since immigration regulations are not under local authority. I would include in that we should also be seeking federal and state funding for those nonprofits that are providing the services currently, and that would be the modification.
Vice Chair, since you indicated we're talking about health services, could we, on that third line, ongoing, insert health and
Yes,
services?
and also
Make it clear?
that's fine, and also to address the concern that was raised by Supervisor Desmond, that if there's any other additional costs that the county would incur, that would come back to the board.
Okay. Is there a second? There's a second to the motion. Any discussion on that motion? Please vote.
Chairwoman Jacob, that motion passes unanimously with all board members being present and voting aye.
We did it. Thank you, and thank you all. I want to do one thing, please. I want to move to